Hello everyone, my name is Jennifer Montgomery and today we're going to be doing the Reflective Discussion 1 where we're talking about field supervision. My relationship with my current field supervisor for this placement seems to be a pretty good relationship so far. It seems to be appropriate and within the boundaries of a professional relationship. I have yet to start my field placement. I'm going to be interning for the Department of Veteran Affairs with the VA satellite clinic in Dover. So I've yet to start because of my background check taking longer to come back. They said they're behind because of COVID. So one of the good things is last week it was kind of a little anxious because I didn't start and didn't really know what to do, but my field supervisor did take the time. He reached out to me probably 3 times last week talking about what we can do moving forward, things that he can do to make sure I get my hours from home. And I really felt like he was truly an advocate last week because he helped push some things along to help get me into the field, hopefully within the next week or so. Since I've yet to start in field because of the onboarding stuff, we have not yet set up a scheduled routine on, when we're going to schedule our supervision, what that's going to look like, if it's going to be weekly, bi-weekly, what we're going to discuss. But I know in my previous placement last year with my undergrad degree, my field supervisor, he had set up weekly supervision that we usually did through Zoom. And that was pretty nice. It was an hour every week of undivided attention to really talk about concerns on both sides. So the unfortunate thing is, though, with the social work profession where I was interning at a detox center, it made it kind of hard to plan for weekly supervision because it seemed like more times than not there was some kind of crisis that he was responding to that he had to work out as he was the manager of the program. But he always did make sure that he would follow up with me to make sure I felt supported and to discuss what we needed to, any concerns on both sides, things like that. Most of my experience with supervision has been task focused. That's just going off of last year and even the interactions I've had with my field supervisor this year. It's mostly discussing concerns from both sides about interventions or approaches used, how to talk with the clients, interact, that sort of thing. Last year when I was at the detox center for my undergrad degree, we did have clinical supervision that we would do. I believe it was monthly that we did, that they let me sit in on, and that was basically like a case review. They would have, they would talk about clients that, the team needed to discuss, and again, would focus on interventions, approaches, things that were working, things that weren't, to try to get like a team focus. I imagine with my supervision this year, my supervisor, he's a LCSW, and he has mentioned wanting to put more of a clinical approach on things. So I'm not really sure what that's going to look like with him, but hopefully we'll get something more firm in the next few weeks. Through doing the reading this week, one of the things that kind of stuck out to me was that the supervision process should not be like a counseling session. It's more about the professional development, and that, it's natural for students to feel anxious or nervous in supervision or even in their placement, and that, if something is triggering you internally, you should seek outside supervision or counseling, because the supervision process is not counseling. So it kind of just stuck out to me because in the past, I feel like supervisors have, tried to encourage me by saying, you have the skills needed for this profession, but it's you need to build your confidence and skill level. So that's something that I'm still working on. I'm told that, it'll come with more experience. And lastly, I feel comfortable with my field supervisor. I feel comfortable talking to him and receiving constructive criticism and feedback. A lot of it, like I said, is about just building that confidence and being comfortable in this role. So I just feel like with this semester, sometimes I worry, am I, bothering my supervisor by reaching out too much, especially with this onboarding process. I feel like sometimes I'm bothering my supervisor because he is busy, he has a high caseload, and he has told me to relax, to not worry, it's all going to work out. So that's something that I'm working on this semester, is just being more patient and having faith and just trusting the process. Thank you.